bill, since it passed in March, as aggressively as we did last year. And I think we need to remember, what was the big debate at that time? The big debate at that time where premiums were increasing, people didn't have insurance, issues with pre-existing conditions, and the debate is healthcare a right? Well, first let's figure out why were premiums increasing to begin with. What goes on with the third-party sector in terms of having a health plan, insurance, and paying for that copay, for many years, from the mid-'80s to the mid-'90s, we would pay a premium and we would get healthcare services in return. As you notice, copays started creeping in and managed care started whittling its way out, because managed care at that time was tightly controlled every part of your healthcare decision, your referrals, your prior authorizations, and as they pulled back on that and allowed for more choices, premiums increased. What didn't change was accountability on the consumer, aka the patient. And it was really entitlement is what we were dealing with for many, many, many years. I want you to get this through your head tonight. You will never, ever, 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 never, ever, 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 never, ever, 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 never have enough money to supply healthcare services, ever, without accountability on the patient. People get older, babies are born, and disease is what it is. So you will never have enough supply of dollars to sustain that. What did Obamacare do? Replicated it. So basically, the government is now the third-party insurer. And so in order to supply health services and keep costs down, which is an oxymoron, you never can, you have to increase premiums every single year. You have to ration care. That's how it works. So let's look about this right thing. Well, how can it be a right if you're taking mine away to supply for somebody else?
Right.
And that person's right was given up to be oppressed for decisions to be made for them. So it's really not a right. It also can't be a right if you never, ever, 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 never have enough money to supply the health system. Therefore, you can't look at it as a supply-demand. Healthcare has to be looked at as a commodity, has to be part of your budget. And the shared risk has to be between insurer and the consumer, aka the patient. We'll talk more about those solutions this evening. Now, those might not believe me and say, well, in Europe they do it. They have it there. And God is so good lately. He's showing all these rallies that are occurring in Europe and issues that are going on there. But I do have a handout for you that I'd like you to take a look at where I compare Germany, Canada, and Massachusetts. And what I did for you, I'm just going to read off of it. If you look at Germany, Germany believes healthcare is a right. We've already debunked that it can't be, because it's non-sustainable. They believe in progressive financing. The wealthier Germans were paying a larger percentage of costs through the income-related premium. 10% of Germans, the wealthiest, have private health insurance. They get to the front of the line, they get private rooms, choice of docs and surgeons. Civil servants in Germany, government employees, 80% of those have private insurance, lo and behold, which make up 14% of the German workforce. Each doctor, listen to this carefully, each doctor gets a budget per quarter. If they use up that budget prior to the end of the quarter, they have to close their practice. And nobody in Germany really knows, they just think the doctor's on vacation. Canada, it's managed per province, it's publicly funded, covers all medically necessary care. It takes up to 40% of the provincial budgets. Spending increases 6% per year, and the baby boomers make up 25% of the population. Massachusetts. Massachusetts started in 2007. Individual mandate to purchase health insurance, an employer mandate, middle-class subsidies, instituted an independent regulatory agency called the Connector, which has a role to restructure the individual and small business insurance markets, aka insurance reform, government-funded subsidies to low-income individuals, and they develop a new physician fee schedule that has not been done yet. This has been the biggest debate. How do you pay a doctor? How do you pay them? What is the fairest way for them to earn the hard work they do every day and to not break the bank at the same time? So let's see what's going on today with Germany. Well, Germany today has increased their employer-employee premiums to 15.5%, up from 14.9%. They're cutting profits of doctors, dentists, hospitals, and pharmaceutical manufacturers. They're cutting programs by $3.5 billion among hospitals, doctors, dentists, and insurers. Insurers, in Germany is similar to what we're trying to do, what Obamacare is trying to do here with that healthcare exchange, where you can buy insurance in Germany as well. And so beyond your tax that you get, in the country to provide healthcare. The insurance that you purchase can ask for more premiums and more co-pays as well. They have been doing that. And they're asking the rich to pay more. In Canada, some of the provinces are experimenting with what they think they should be doing. In Ontario, they're cutting pharmacies and drug companies. In British Columbia, they're replacing grants with hospitals with fee-for-service. In Quebec, the new flat health tax and proposal for payments on each medical visit. And they're asking physicians to become salaried government employees. What's going on in Massachusetts? Since its inception in 2008, total healthcare spending has increased by 28%. Insurance premium has increased by 8 to 10% per year, and Massachusetts now has the highest average premiums in the nation. The number of people gaming the individual mandate, buying insurance only when they're about to incur major medical costs, and dumping coverage has quadrupled since 2008. State Senator Richard Moore of Massachusetts has introduced a new bill that will make physician participation in government health programs as a condition of medical licensure. This would essentially convert all Massachusetts doctors to public employees. You can never, ever, ever, never, ever, ever, never, ever have enough money to supply healthcare services, ever. And we'll talk about those solutions this evening. I also have a handout for you on the timeline of some of the perks that are coming in. Have already started with the healthcare bill, but will peak in September. And that's a concern for me, for candidates who are running this fall. Because people are going to be like, well, what's the problem? I'm getting coverage now. Okay, so let's use one of the perks that are coming in after September 23rd. One of the perks is free preventive screenings, colorectal, mammograms. Free preventive screenings are happening after September 23rd. That's a really nice thing if you have a primary care doctor, which we don't have many. And where do you and do you think they're going to wait 6, 8, or 10 months for a doctor's appointment and actually make that appointment? And do you think they really want to deal with prevention? Those who didn't have insurance and now have it. Where do you think they're going to go when they get sick now that they have health insurance? To the ER. ER admission rates in Massachusetts has doubled because no one's using those little perks. It might look good the first year, but after the first year, the care will get rationed, as it has in Massachusetts. They have a 4-level insurance program based on income. The lowest level are for those that really need it, and they've actually increased the poverty level because they don't want many people to get it, because they can't afford it. So, if you can remember 2 things: why it's not a right, you can't take mine away or give yours up. And secondly, you will never, ever, 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 never have enough money to supply health care without accountability. Thank you.
Guys, say that never, ever, ever, ever. Never, ever.
I think I'll go to sleep thinking about it.
All right, let's go to Dr. Kaplan now. What do you think the impact